Hi. Okay. So we are online, right? Okay. Okay. Good evening, everybody. I hope you are having a great night, great coronavirus night. I'm just kidding. Okay. Please to engage if any one of you if you are online, please to make sure to post your questions, and I'll get back to it. Actually, did not because I was hoping that something good will happen with the whole coronavirus thing. But then, and I was hoping that for it to do it because ultimately the people, the citizens, us, the citizens, we gave them the authority. We gave them the authority to take care of us in such kind of situations. But it looks like we made a big mistake. Just kidding. But yeah, that's what it is. So I want to address this very grave concern, this issue of grave concern, right? Coronavirus. By the way, this is black tea. Okay, this is not alcohol. This is black tea. So okay, so here we go. Today, the patient who was infected with coronavirus, right, had been in one private hospital in Dimapur, right, and then later on, that's what I heard. I may not be right, but then later on, the patient was taken to Guwahati, and that's where the patient was told that the patient had a positive case of coronavirus. Now, this is the thing is it's a very it's this case itself, it's very disturbing because uh, we know that from the social media source that the patient had arrived from Kolkata, I think, yeah, and then he had been in Dimapur, going outside, working, and also doing some voluntary work, right? Now, imagine how many people that person had infected. Just imagine that, and I have to give a shout out, right? I have to actually give credit to Dimapur Ao Student Union. They actually wrote a very um, resounding letter towards resounding letter to the government of Nagaland, right, about this very lack of transparency, no accountability on the part of the government, right, to do anything serious, to do anything concrete with regards to tackling the coronavirus in Nagaland, the COVID-19 virus in Nagaland. And I think they did a good job. And I think I really admire the Dimapur Our Student Union for doing that. All thumbs up to you, and give up the good work. That's how we should be. That's how we hold the government accountable, because the government of Nagaland, the way they've handled the situation, shows an utter unconcern and apathy, or some sort of laziness towards this virus, right? Utter lack of transparency, no accountability. They just look busy, right? They just look busy, just putting on an act. They are just putting on an act that just to show the people that we are doing something, right? That we are doing something. When in reality, they are doing nothing, right? All for the sake of formality, right? Because the government is very good with formalities, right? Just to show that they're busy, that they're doing something. They like to run around do nothing, right? That's what they're good at. So this is very, very serious because there was this one study. It was in yesterday's paper, I think, yesterday's or today's newspaper. There was one press notice given out by the Indian Council of Medical Research, right? Indian Council of Medical Research, and in that's one of the that's the key, that's the flagship of Indian Medical Council, right? The Indian doctors. So in the press notice, what the Indian Council of Medical Research, up to 400 persons, 400 individual in 30 days. Imagine that. And this is not a lie. You see, people in Nagaland are very, very, they are very, they like to use facts. No, not they like to use facts, but they don't like facts. People in Nagaland don't like facts whenever we talk to them in facts. So the doctors, the Indian medical, the Indian Council of Medical Research says that one coronavirus patient can infect In fact, up to 400 persons, 400 individuals in 30 days. In 30 days. So imagine how many individuals did imagine how many person did that individual who got infected in corona, who got infected with coronavirus here in Dimapur, infected people, right? Unknowingly, people may be infected, and after you get infected, you go home, you go back to your shops, you go back wherever you stay, and then you infect more people, and then that's how the infection grows, right? So this is something very very serious, and the government of Nagaland has been not doing a very. I will get to what I mean by that more in detail later on, but this is just an introduction. This is an introduction to what we'll be talking about tonight. Nagaland, right? The government not caring about the people. So far, the thing is, because prior to this confirmed positive case today, so far we had no positive cases prior to this, right? We had no positive cases of, right? The government was not giving out any proper information, and even the newspapers were not pushing the government to give the right information, right? This is a failure on the part of the press in Nagaland. You have not done a good job, press. All the newspapers in Nagaland, you have not done a good job. So so far we had no cases prior to this, right? That's what we were told. We didn't know. That's what we were told. So we had no cases so far, and this, I feel like, what happened is this: the government were not fully prepared. The government was not fully prepared. They were not properly and fully equipped, and this shows how haphazardly, right? How haphazardly the government of Nagaland is and was to tackle this issue. You see, the rampant misuse of public funds prior to this outbreak has really come to bite them in their back, right? Because this the government, they had no care for the funds given by the center to use for projects which were meant for development, which were meant for instance, the medical college in Nagaland, right? The medical college was supposed to be finished 2 years ago, at the latest, 2 years ago or last year, right? How long has it been since the government approved the construction of medical college, right? If the medical college in Nagaland had been constructed, right, then at least, at the minimum, we would have a coronavirus testing lab here in Nagaland, right? Coronavirus testing lab here in Nagaland. But we don't. You see, but we don't. We would have a medical college that would be prepared to take on patients who are infected with coronavirus. But now we don't, right? I don't think right now, not many hospitals in Nagaland are ready to do that, ready to take on coronavirus patients. Indeed, there may be government hospitals, there may be government hospitals who may claim, oh, we are ready. But if you go and see the conditions, then you will know, right? Then you will know what that ready means, right? What that ready means. This lack, this lackadaisical attitude, this lazy, apathetic attitude to the plight of their own people, right? This careless attitude towards the suffering of its own people, of its citizen, is going to severely damage the reputation of this government, as well as most of the politicians and the leaders and the bureaucrats and all the government servants combined, right? No excuses. You have let the people of Nagaland down. You have let the citizens of Nagaland down. You will have to pay the price. You will have to pay the price. Such a lazy, apathetic attitude shows the. It also shows the lack of health policy in Nagaland. Nagaland has no health policy, right? You have, in most modern society, you have health policy. Why do you have health policy? so that just in case, whenever you do have such pandemic, right, whenever you do have such pandemic happening, you can effectively, right, effectively and properly take care of it, take care of the citizens, right, tackle the problem. But we don't have, of course, even India has a very mm, dismal health policy, right? And Nagaland, we have none. We don't have, right? We have no. Actually, you know what? All this, all this, all these things which I'm saying right now, right? All this, lack of government action, lack of government to do anything, only shows this is the kind of society you get whenever the society is filled with backdoor appointments and corruption, right? So in a way, people in Nagaland did ask for this, right? I think, right? Maybe, right? So the thing is, Nagaland has no health policy. We should have had health policy long time ago, so that the society, so that the government would be ready to tackle any sort of health pandemic that occurs in within its constitution, within its jurisdiction, right? But no, we have none. I've been waiting for the government of Nagaland, right, for a long time. I wanted to talk about this earlier on, 2 weeks ago, but I waited. I gave the government of Nagaland the benefit of the doubt that they will come step up to the challenge and do things, right? But guess what? Nothing. Guess what? Nothing. I've been waiting for the government to skillfully, right? Skillfully and adroitly deal not only with the containment of this virus, of coronavirus, but also in worst case scenario, be fully prepared as it can be, as fully prepared as it can be to look after and cure those who are infected, which seems to be most likely. Like I think this is most likely. I mean, we will have. I hope I'm wrong. I do hope I'm wrong, but I know that because this infection went unnoticed for a long time, it has infected many people. I know that. I mean, you'll have to be a person with no common sense to think that, oh, it's otherwise. You can't, right? Any person with a speck of common sense will know that it will be affected by it. And one of the key steps, right? One of the key steps which almost all the states in India, as well as all the countries in the world are taking, is the testing of its population, right? I've been waiting for the state government of Nagaland to initiate the testing program, right? To test its population of coronavirus. You see? But so far, we have only we have only 76 confirmed cases of testing. Only 76. Only 76. One of the we are the lowest in among Northeast, among the Northeast states. We have the lowest number of testing for coronavirus in Northeast and even in India. Even in India. According to the newspaper yesterday, I think, or today, we have 70 tested, right? 70 tested, right? And six more awaiting results, right? But I will get to that more. I will get to that more later on. So I've been waiting for the government of Nagaland to start with this testing, this coronavirus testing. But so far we only have 70. How dismal is that? Right? And the reason why I'm talking about testing is because the more you test, the better chances of fighting coronavirus. Right? Because the more you test, you have better idea about the possible hotspots in the city or in the state, right? Where there's the possible hotspots of coronavirus, right? With more testing. And with more testing, you can also identify those groups of people who are most vulnerable to this disease, to coronavirus. You also identify with more testing, you also identify those group of people or those segment of people who are most vulnerable to this disease. And thus you can take active steps to prevent the spread of virus. And this has been the case in South Korea, right? It has. Now this is also in Delhi. Even in Delhi, this is happening, right? Even in Maharashtra, it's happening, right? So that's how you deal. That's how you deal with this case, deal with the coronavirus. But so far we only have a pathetic number of 76. Just imagine, Nagaland has around 20 lakhs, right? 20 lakhs population, 20 lakhs. And out of 20 lakhs, only 76 has been treated. Imagine 76. I do not know how else to tell you this. Like how else to show you like the ratio. Like literally, we have 20 lakhs population and only 76 people have been tested, right? This is actually to give you some perspective. This is actually not even 1%. 76 is not even 1% of 20 lakhs. It is less than, this is 1%, right? This is not even 50% of 1%. It's like 3% of 1%. You can point, right? This is 1%, and 3% of 3% is 1%. Only 3% of 1% has been tested. 76 people. Compare this. Compare this number with Assam, right? Assam has tested 3,002. This is the source is from Hindu, the newspaper Hindu. If you don't believe me, you can go and check it out, right? Because I don't just say things, right? I just don't say this. Whatever I say, I back it up, right? I have a source, right? I say this is where I got it, right? I don't lie. So Assam has tested 3,002 people, right? 3,002 persons. Manipur 233 Manipur. Arunachal 224 224 in Arunachal. Mizoram 87. And Mizoram has less population than us. Mizoram has, I think, 17 lakhs. I don't know, less than us. Mizoram, right? 87 people. Nagaland the lowest, 70, right? 70. That's how pathetic we are. And not only that, you see, I want you to know this. You see, there's also this issue of testing. Whenever we are testing, right? You see, whenever those 76 people who tested for coronavirus, right? Who sent the samples to coronavirus, the testing lab is not here in Nagaland. Nagaland has no testing lab, right? We have no testing lab. So what do? We take the samples from the person, we take the test samples, and then we send it either to Guwahati or to Imphal, right? We send it to them because we have no testing lab. And what happened is this: the test samples, right? Follow me, right? The test samples from Nagaland, we have to send it outside, right? Due to which the results will be delayed. That's why we get delayed results, right? We have to wait for a long period of time to get the results because we have to send it to to Imphal or to Guwahati because we don't have medical college here, right? Medical college we don't have here, right? Furthermore, even the test samples, right? Even the test samples is compromised. In other words, it's even the test samples whenever we send them, right, is tainted, right, is spoiled, right. The test samples is contaminated, right, because whenever you do take a test, it has a very limited amount of time in which you must conduct the test, and if you go beyond the time, there's no point even doing the test, right, because whatever you get is the wrong information. You get It's not even worth doing the test because you have certain limited amount of time within which you must conduct the test, and if you don't do it, there's no point. So what happens is that by the time the test samples from Nagaland goes and reaches Imphal or Guwahati, the test samples are already contaminated, right? Just to give you an idea, so far all the test samples, right, like in the newspaper it says yesterday or today. I have the newspapers here with me. I can show you, but then that would just look weird, right? But all the test no, it's a serious matter. It's a serious matter. All the test samples came negative, right? 70 of them. Six we are getting results. All 70 of those test samples came negative. Now, if you are a person with brain, right, then you would think something is wrong, right? Something is wrong. However, the thing is this: because it takes certain amount of time to reach Imphal or Guwahati, the quality of the test sample will be the test samples are already contaminated, They are compromised, spoiled by the time they reach the lab for testing. And hence, when the testing is done on these contaminated test samples, the result it gives out is negative, right? In other words, the result of the contaminated test samples is negative. In other words, a false negative. And now the thing is, what do I mean by false negative? By false negative, it only simply means this, which means that a person is actually infected with virus, but because the sample, the test, right, the test is already spoiled or contaminated, right? Because the sample is already contaminated. Whenever you do a test on that sample, the result will be negative. In other words, the result says that the person has no infection, when in reality they do, right? And I fear this is the case. I fear this is the case in Nagaland, right? Because we don't have testing sample over here, we cannot be sure, 100% sure that we can actually trust the results of those negatives, 70 negatives. I fear most of the negatives are false negative. In other words, some of those individuals, those patients will actually be infected. That's what I fear. In such a scenario where you get this false negative and you believe that, in such a scenario, the virus may have affected so many people in Nagaland, right? We may be unaware of it. We may be uninformed, ignorant that we are infected by it, when in reality we are infected by it. So imagine you are ignorant that you don't know. You're ignorant that you are infected with coronavirus, right? So you go outside, you go with your family, you stay with your family, you go to the shop, you go to bazaar. Imagine how many people you have infected, right? Not only are you endangering your life, but you're also endangering the lives of others, the ones you love, the ones close to you. Now, imagine what kind of government is this, really? Do they really not care about the citizen? Really? I am just baffled. I'm speechless. I have no word to express the pain and sorrow. No, but it's so frustrating. What kind of government do we have? Right? In this case, who knows how many people are infected? Right? How many people are infected? How many infected patients are unknowingly infecting others? Right? Just imagine. And like I said, like I mentioned earlier, right? The Indian Council of Medical Research, right, had said precisely that one person can in fact can spread the disease, right, to 400 people in 1 month. So even in 15 days time, you spread around 200 people. Imagine 10 days, 5 days, 100 people. In 5 days, you're infecting 100 individuals. This is dangerous. The government of Nagaland is severely risking and compromising the health and safety of its people. I think they have. The thing is, the government of Nagaland have already risked and compromised the health and safety of its people. Right? They are supposed to take care of people, of its citizens, of the average people, and all they are now doing is to give out a little information to the public about the reality of its situation. Right? They're not giving out the full information. Maybe they are hiding the information. Oh, I'm sorry. They're not hiding. They're too ignorant and unaware to know their own shortcomings, right? They're too ignorant and unaware of their own shortcomings, right? They are. And and in fact, it was, I think, last week, the minister of, who was it? The minister of Health and Family Welfare, right? Mentioned that we'll be setting up the government of Nagaland will be setting up test lab in Dimapur. Oh, but you can be sure that the money will be lost somewhere in this bank account, right? Right? Yes. And even the money sent by the center for the what is it? I don't know, but it's the disaster, the National Disaster Fund, something like but you know what I mean, the National Disaster Fund, something like that. The central government sent 122 crores, right, to it. So who knows that money will miraculously, right, go into the bank accounts and coffers of, living from chief minister to his lackeys, right, chamjas, and his close associates, right? Who knows, right? But this is the kind of situation that we are facing, right? There's more to it. It's I cannot I cannot I feel I see the helplessness, right, of the people, the citizens. I feel people are helpless. They are. If something bad happens, right? If something bad happens to them, most of the people in Nagaland are poor. Really, they are poor. We are not rich. We are by no means rich society. Most of the people are living hand to mouth. If something bad happens to them, right? If they are infected by coronavirus, who will take care of them? No, really. Even now, even in this at this moment in time, there are many people who can't even have food. Why? Because they don't have money, right? Why do they not have money? Because they are not politicians and bureaucrats and engineers and contractors, right? Or government job holders. They live hand to mouth. They have no money to buy vegetables. They have no food to eat. They're starving. What the hell, really? Do you not care about your people? Do you not care about the citizens? There, there are many people starving right now. They would rather die than starve. What about those people? Do you really not care? Are we that blind to the sufferings and miseries of our own people? Do you have to be told what I'm telling you right now? Really, this is ridiculous. And also, the government of Nagaland may say, fine, we have only 76 tests. But guess what, right? They will say because, government is good with excuses and people in Nagaland in general are very good with excuses. We cannot beat Nagas, right? People in Nagaland, we are very good with excuses. We are very good. They may say, oh, but guess what? We have screened. They will say, oh, but we have screened 793 people, and that's today's newspaper is there. They will say, oh, but we have screened 793 persons for COVID-19. Aha, yeah. But then let me tell you what that screening is. I'll tell you, all right? For everybody. Screening is just this, right? It's simply screening is this. Don't be fooled by what they're saying. When anybody says screening is different, testing is different. Test is you actually test, right? Testing is only 70, right? 76. Screening is different. Screening, the government of Nagaland claims, and the number is who knows, right? Nagas, people in Nagaland we like to play with numbers. So the numbers, according to Nagaland Post, right? 793, right? 793. I'm sure the Nagaland Post got it from the department, from the concerned department, right? 793. And they say government of Nagaland will say we have screened 793 individuals for COVID-19. But let me tell you what screening is. It simply means this: screening for screening for COVID-19, right? It's nothing but a series of questions, right? You ask questions to the patient. So here you are, there you are, here I am. So say for instance, I'm screening you for COVID-19. So I'll have a piece of paper with me, right? And I'll say I'll have questions over here. So I'll ask, how are you feeling, right? Were you sick, right? That's screening, right? That's simple. That's screening. So screening is a series of questions. Screening, right, is nothing but a series of questions asked to determine a person's risk for COVID-19, right? They include questions about symptoms being experienced, right? Travel history in recent weeks, and exposure to someone who has been infected by COVID-19, right? And only after screening and consulting, then they will decide whether you should go and take the test or not, right? So not necessarily just because you take a screening, right, doesn't mean that you'll be sent for testing. No, screening is just asking questions. How do you feel? Did you cough? Are you having a headache? Are you having a fever? Where did you travel? Right? Were you with somebody who had who was infected with COVID-19? That's screening. That is it. So the thing is, so these are the things. I am I'm quite pessimistic about the situation, really, in all honesty. And with this positive case of coronavirus in Nagaland, from Dimapur, I'm quite pessimistic about the situation. Especially, I don't care about myself. I really don't. But I do care about what happens to the poor, the helpless, those who are living daily wage earners, right? Think about them. It's not enough to go and show your face in the newspaper saying, "Oh, look at me, look at me, I'm doing a charity work." Nobody gives a, you know what I mean, right? Nobody gives da da da, right? Star, 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 right? Nobody gives a thing, right, about seeing your beautiful face in daily newspapers, right? We don't. It's too late. That does not count, right? So this is the current. So what I'm trying to say is this: this is the current predicament, right? We're in this conundrum in Nagaland. The government, I'm sure the government is doing all that it can, but it's not enough. Now they need experts. They need medical experts to assist them with making necessary arrangement for this pandemic, right? They need experts. They need economic experts. They need experts from the field of medicine, from the field of politics, from the field of economics, right? To deal with all these things. It's not easy, but they must do that, right? And the government, as well as the concerned departments and all those who are actually in charge and all those who actually have the power to do something about it, should actually take a prudent and courageous actions to mitigate these problems. Because I feel that if this virus spreads, and which I fear that it, which I really fear, then we are going to have a big mess in Nagaland. I hope I am wrong. I hope I am wrong. I do hope that I am wrong. But because the thing is, we must take this thing seriously. The government must take their job seriously, must see this challenge seriously. Because I'm afraid that even Hornbill Festival will not be able to bring cure to this virus, right? Right. The Hornbill Festival will not be enough. No, it will not be enough. And I hope that the government of the land of festival will be able to step up to this challenge and actually care for its people. Not only just care, but also do something concrete and effective in order to combat and mitigate and limit the spread of COVID-19. They don't have to look that far. If they need help, call the government of India, central government of India. There's so many. Look elsewhere. You can find so many examples. If you need help, go and ask professionals, right? Go and ask academicians. They will tell you how to take care of all these things, right? So I do hope that you will forgive me if I've offended anybody. Well, I don't care if you don't forgive me also, but there you go. But I hope that I hope you don't forgive me. But but then again, that's the truth, right? We don't like to. Some no, but I seriously don't. I'm speechless. I really am speechless. There are so many things in my mind. I just want to bust it out loud, but then this is all I can do right now, right? I do hope that I, I see some of your comments. It's really funny. I really like it. So keep it up. Thank you all. Thank you for joining me on this live stream, and thank you for all the comments. And I really like it. I will get to. I will. I would like to answer all these questions later on. All right, because right now, because I cannot do it. I mean, it'll be gone for forever, right? If I do this now. So I hope you don't mind. All right. But thank you all, and then I good to see you two guys, and yeah, yeah, and I hope it was fun, right? I hope it was fun, right? Thank you so much, right? And good night. And please, 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 stay safe. Take all necessary precautions. All right. Always wash your hands. Use sanitizers, and also try to keep yourself warm. I think warm is very important. I think if in heat, I think the I'm sorry, I won't say anything because People may think that I'm trying to, start, a cure for coronavirus. But then this message is brought to you by the Department of. I'm just kidding. Right? Stay safe and please take care and please pray. Pray for your health. Pray for your family and pray for the helpless, pray for the needy, right? And pray for the society. And also pray that God will give guidance and wisdom to our leaders, right? Because they truly need it, right? Because they are really, really, they're really, really star, right? So they really need it, okay? And please pray for everybody, for yourself, for your loved ones, all right? Because prayer is very, very powerful, right? Please, okay? Because it will be you, it will be because of your prayer. If anything good happens, it will be because of your prayer. If anything, if we can get out of this conundrum, it will be because of your prayer, right? So please pray, right? I love you all. Thank you.